Hello and welcome to our weekly update at the Peoria City County Health Department. I'm Monica Hendrickson, the Public Health Administrator, and for the Tri-County region of Peoria, Tazewell, and Woodford, today we're reporting a to-date total of just under 5,000 cases at 4,963. That's an increase of 541 from last Thursday. That includes 3,092 for Peoria County, 1,488 for Tazewell County, and 383 for Woodford County. This was a difficult week here in the Tri-County. We lost 8 residents to COVID, including 4 from Peoria County, 3 from Tazewell County, and 1 for Woodford County. Overall, our Tri-County has seen an average of about 77 cases each day, which is an increase from last week when we were averaging 71 cases per day. Likewise, in Peoria County, we've seen an increase. This time last week, we were averaging 40 new cases each day, and now we're at 47 new cases. There is some good news. Overall, our community numbers indicate that the majority of individuals are recovered. 78.1% are recovered, which is an increase of close to 5% from last week. We still have under 20% at home and recovering, hopefully, and then just under 1% currently hospitalized. In regards to our hospitalization, for today we have 20 confirmed ICU cases and 38 non-ICU cases, and are reporting 1 death in our hospital systems in the past 24 hours. In regards to our ICU usage, is increased from the last week to 16 ICU beds, as well as our total number of beds now sits at 51 in use, which is an increase of 4 from the previous week. While our numbers indicate that our trajectory is increasing in certain areas, overall we've seen decreases in our positivity as a region. That's something we want to always advocate for. Our community is very lucky to have 2 large community-based testing sites, one at the Civic Center and the other one through Heartland. Taking advantage of those tests is really key. Again, oftentimes people indicate that they thought their symptoms were very mild, maybe seasonal allergies. And so utilizing these test sites to verify that they are allergies versus COVID is really important to help control the transmission of our virus in our community. And overall, we've seen a great level of compliance by communities. We've seen restaurants and our retails really focus on educating the public about the need to practice social distancing, as well as the importance of wearing face coverings in their facilities. And so while we do get complaints, majority of them, I would say, are the hypervigilant individuals, and we appreciate their concerns that they have when they do notice individuals not following those key directions. But overall, our community has done a great job in those face coverings, and we hope that you continue to do that as we progress into our flu season, as we also see that with the colder weather, we're going to be looking at gathering indoors more. We've been very lucky this summer to have, seasonally well weather that we could socially distance and gather with friends outside. And so as we are getting colder and moving indoors, you really need to focus on the size of your gatherings, making sure they're limited. Again, socially distancing and wearing face masks. Those are going to be key. We're not saying that you can't gather in person, but again, recognizing that the virus transmits person to person. So by creating those barriers and creating those gaps, you're slowing the virus down and preventing other individuals from getting sick. With that, we hope that there's going to be additional guidance that comes out in the upcoming weeks, especially as we're about to hit the holiday season. Likewise, I said it last week and I'll continue to say it, flu vaccines are available in our community. And if you're over the age of 6 months and are able to get a flu vaccine and it is medically possible for you to do so, we highly recommend that you do. The flu vaccine does not give you influenza. In fact, what it does is it creates herd immunity to protect those individuals that can't get vaccinated, such as young children or those that are immunocompromised and unable to get vaccinated. Likewise, if you were to get the flu while being vaccinated, your symptoms would be much more milder. This is, again, a way for us to not only protect each other, but also protect that limited resource that we continue to talk about, our healthcare capacity. Every flu season, our hospital systems see an uptake in those using their ICUs and needing ventilation. By getting the flu vaccine, you're again protecting that resource for individuals that will need it, especially those that have COVID-19. So if you can, again, please do get vaccinated. Thank you, and stay healthy and safe.